people to know how much we rely on primary care. And when it works well, it's pretty magical. That's embedded in the community, understands the community, and by virtue of being there, strengthens the community and the health of the community. Hi, I'm Maret. I'm a fourth generation dryland farmer and farm with my brother and my husband. I am also a recently retired educator, and I have a daughter, and we live on our family farm in rural, agricultural, dryland, dry, arid Colorado. So I was lucky enough to have a primary care provider for, probably over 20 years that my whole family used. My father, myself, my husband, my daughter, ever since she was a wee infant. And we had this long relationship with her until she retired. And that was really magical. The fact that she knew all of us, that we had known her for a really, really long time, really felt like primary care at its best. She knew us well. She knew our family dynamics. She knew our stressors and our strengths. She knew the levers and kind of how we operated. She knew when we just needed a warm space to talk and listening ears. And then she also knew when we actually needed some action. There are several stories here that seem really relevant about her ability to really know us as a family and understand our needs. When my father's mental health was poor, or his dementia was starting to increase, his response to her question around, "How is everything, sir?" was always, "Oh, I'm fine, I'm fine, I'm fine." But because she knew all of us as a family, she knew that she could ask questions differently and how to ask those questions, because we had talked about it as a family, and she knew to dig a little deeper. We always felt heard. We always felt like our needs were met. I love that I had this partnership with my primary care provider, and that she could help us think about ways to manage our health that wasn't always a pill, a prescription, or an easy answer. And I relied on her for that. But I have a lot of worries about it. And part of that is the stressors that primary care is facing, and the stress around the needs that patients have and their inability to kind of be everything for everyone just because they're so short-staffed, because there's been such a stress on the system. My worry is that primary care is going through a burnout and is short-staffed, and that they are unable to provide that for me, not because they don't want to, but because they just can't. And so that really concerns me, and that concerns me about my own health, but also the health of my community. So if primary care were to be unsuccessful in my community, in my rural community, and we were to lose one or two or many providers, then we are faced with having to travel significant distances in order to receive care. Then we go without care. And then as a community, our health erodes. We don't seek care for strep and the flu and COVID and viruses. We don't seek care for bad knees, bad ankles, bad shoulders. We don't go to work as much. We can't do our work as much. And all of that becomes part of productivity, ability to feed our families, and good mental health. If we can't kind of purr along productively, then the health of the whole community erodes. So it's pretty devastating. In a community like ours, if there's not good primary care, we simply don't have access. We can't go down the road to get it. And so I want my primary care office to be vibrant. I want it to be fully staffed. I want it to be well funded. And I don't want to have to worry about them quitting and giving up because this is an unsustainable position.